Welcome to Module 3, Core Content Part 1, Before They Touch a Patient. This video covers the 5 foundation areas every certified nursing assistant student must complete first, as mandated by the Virginia Board of Nursing. Let's explore why this cluster of foundation skills comes first in the curriculum. Here's something that surprises a lot of new CNA instructors. You can plan a great lesson. You can build a detailed schedule. You can have the skills lab set up perfectly. And still, if your students enter clinical before these 5 areas are covered and documented, you have a compliance violation on your hands. And the liability is yours, not the students, yours. Virginia law is specific: 24 hours of instruction before any direct patient contact. 16 of those hours must come from these 5 areas: structured, objective-based, and documented. Not orientation day, not a tour of the facility. Actual instruction with learning objectives. On file, you are the gatekeeper between your classroom and a vulnerable patient. These 16 hours are how you protect both. The first foundation area is communication and interpersonal skills. Think about the last time you had to redirect a combative patient or explain a procedure to someone who is terrified. You figured it out because you are a nurse. Now imagine your student, week 2, no clinical experience. The moment that resident looks at them confused and says, "What are you doing to me?" they freeze. That is why communication is not soft content. It is a clinical skill. VBON requires you to teach it. Therapeutic techniques, professional boundaries, reporting, and strategies for cognitively impaired residents. On the exam, it shows up everywhere. A perfect bed bath performed in silence loses points. Give them scripts. Role play the hard moments. Reinforce it every session. The second essential area is infection prevention and control. Hand hygiene is the skill your students will perform more than any other. It is also the one they will get lazy about fastest. Week 1, perfect technique. Week 3, skipping the thumb. Week 5, faucet touched with a bare hand after washing. You have seen shortcuts in clinical. Now it is your job to catch them in the lab before they follow your student into a room with a vulnerable resident. On the exam, hand hygiene is evaluated in nearly every skill scenario. Wrong sequence, scrub under 20 seconds, or touching the faucet, automatic failure. Observe it every session. Correct it every session. Never assume it is done because you taught it once. Next, we focus on safety and emergency procedures. Your CNA students will be the ones in the room when a resident tries to get up unassisted. They will be doing transfers with residents who have fall histories and one-sided weakness. They need to be ready. Falls are the leading cause of injury in long-term care. Body mechanics, safe transfers, and emergency response are not background content. They are the skills that protect your students and their residents. On the exam, gait belt transfers are heavily evaluated. Unlocked wheels, no verbal communication, wrong foot position. Any of these fails the skill. Model correct body mechanics every single time you demonstrate. Students learn what they see. The fourth foundation area is promoting client independence. This is where nursing instincts can work against your students. Nurses are trained to act, to fix, to do. But a CNA who does everything for a resident, even with genuine care, contributes to functional decline. Students need to learn to pause, ask, and wait, even when it takes 4 minutes for a resident to button their own shirt. On the exam, examiners watch for exactly this. Does the student offer choices? Wait for responses? Adjust their pace? Students who rush lose points, even with perfect technique. Model patience explicitly. Show them what waiting actually looks like in practice. Finally, we cover respecting clients' rights. A resident in long-term care has given up almost everything: their home, their routine, their privacy. What they have left are their rights, and those rights are protected by federal and state law, not just facility policy. A CNA who exposes a resident, shares a diagnosis in the hallway, or ignores a refusal of care is not making a small mistake. They are committing a legal violation. On the exam, this shows up in every skill. Knock, drape, explain before you touch. Each missed step is a deduction. Rights violations trace back to instruction gaps, not character gaps. That gap is yours to close. This is a summary of the 5 foundation areas in Cluster 1. 5 areas, 16 hours, documented before clinical begins. Communication, teach it as a skill, script it, reinforce it every session. Infection control, observe hand hygiene every session. Correct shortcuts before they reach clinical. Safety, model correct technique every time you demonstrate. Students learn what they see. Independence. Nursing instincts say do more. This area says do less. Model patients explicitly. Client's rights. Legal standard, not policy. Make it personal. Revisit every lesson. These 16 hours protect your students, your residents, and your program. Push pin 18, VAC 90264, OA1. Thank you for watching this core content video on the 5 foundation areas that must be completed before students touch a patient.